The next question, the member for Don Valley East.
Well, thank you very much, Mr. Speaker. My question is to the Minister of Health. Minister, in March, the College of Physicians and Surgeons launched a program to issue short-term licenses to allow some foreign-trained doctors and domestic medical school graduates to practice under supervision. But it's my understanding that by April of this year, only 12 people applied. In April, the government announced a program to help former international healthcare providers and medical students connect with institutions to offer additional support. Through you, Mr. Speaker, to the Minister. Can the Minister update this House to whether the program has been successful and how many international medical professionals have applied and been approved?
Questions to the Minister of Health.
Well, I thank the member very much for the question, and I would say that with the COVID pandemic, we have been welcoming people with healthcare backgrounds of all sorts. We have asked for people to join as through a volunteer line. We also have a connection panel that connected people, organizations that were looking for help with people who were ready to volunteer. We had many nurses who came forward out of retirement who worked with the College of Nurses to be recertified. We had many internationally trained medical graduates who came forward as well, who have been very helpful in numerous areas, including contact tracing, working at the assessment centres and elsewhere. So while I have had a number of inquiries from them about their ability to go immediately to the College of Physicians and Surgeons to be certified, we all know that there is a process that has to be followed, but I'm sure that their experience locally is going to be of assistance to them. But of course, that's going to be up to the College of Physicians and Surgeons to make that final decision.
Thank you. The supplementary question.
Thank you very much, Mr. Speaker. Minister, 12 applications is simply not good enough. In Ontario today, we've got 13,000 foreign-trained doctors, 6,000 foreign-trained nurses in Ontario today. And we know that 10% of the COVID cases are healthcare professionals. The system is being pushed to the brink. It is completely unacceptable to leave those professionals on the sideline and waste that talent. Minister, would you consider running some type of public awareness campaign to get the word out there so we can increase those applicants and get people working? It is a waste of those resources.
Minister.
I agree with you that we don't want to waste any valuable healthcare resources that we have, and I know that there are many internationally trained graduates who are ready to work in Ontario. There are also a number of students from Canada who've gone to do their residency in the United States, for example, who want to come back to be able to work. There are many, many people that are in that situation. So we certainly want to encourage them to apply to the College of Physicians and Surgeons, and we're continuing our conversation with the college as well. But ultimately, they need to be qualified to practice in Ontario. We need to have those standards met. But there is more work to do, absolutely, because we don't want those resources to go to waste. So thank you for bringing the question forward.